It is my honor to interview Dr. Walensky, and I want to invite Dr. Walensky to open up her video channel, make sure that we can see her and hear her. I know that her timing is tight, so we want to get as much chance as we can to speak with you, Dr. Walensky. Let's see if we can see your video this morning or not. Hey, excellent, great.
Good morning.
Good morning. This is working out great so far, perfect. I want to get right into questions. I know there are so many questions for you, but first, you parachuted into this job as CDC director. And I wonder if you can help us understand your world a little bit better. I know there's no day that's the same as the day before it, but how do you organize your day? What is your world like? How do you work?
First of all, I'm really just delighted to be here and delighted for this interview. It has been an interesting 9 months. There are so many things that I tend to be an organized person by design, but there are so many things where you really do have to say, what is the urgency, emergency of today? And what are the things that I absolutely need to get done today to really productively move things forward? And importantly, what are going to be the questions of tomorrow? And what do I need to do today to make sure that we can answer those questions tomorrow? So sort of when I think about how I organize my day, those are the things that I really prioritize.
On a human level, I'm curious though, I mean, what time are you waking up? Are you eating? Are you sleeping?
I have incredible family support. So I'm a 5:15, 5:30 a.m. kind of wake up person. I do try and work out a couple of times a week to just maintain my sanity. I have a wonderful family who feeds me well. And when I'm traveling, will not infrequently deliver me groceries wherever I am. So I'm doing okay. I'm doing great.
Okay, good. That's helpful. The exercising is impressive. I want to get there. I'm not quite there yet. So I want to talk about this moment right now. And I think woven through our conversation is going to be a subject close to your heart: data and decision-making with data and research. And that's what we're here really to talk about. And one of the items that is a major discussion for scientists and for you right now is the idea of booster shots. There really has been a lot of back and forth about whether booster shots are necessary right now. The vaccines preventing serious hospitalization, those kinds of things at this point. But obviously now the Biden administration is planning to roll out a major booster effort within just days. Now, I wonder if you can tell us exactly who you think should be getting those booster shots, what the plan is right now, and what does the data support here? How do you see this?
Right. So thank you for that question. That is top on so many people's minds right now. The first thing I want to just say and then put aside is that we know that among the things that we need to do as we're planning a lot for booster shots is to really focus as well on the unvaccinated. So I really do want to highlight that while we are focusing on booster shots, we cannot take our eye off of making sure that people who are not yet vaccinated get vaccinated. So let's say that, but also turn to the importance of the data that we are going to need to collect to understand who and when booster shots can and should be given. We at CDC, I'm really pleased and proud to say, have been following a group of cohorts of selected people across the country to follow the question of how are our vaccines working. Now, we have many of these cohorts, tens of thousands of people, 4,000 healthcare workers that are getting a test every week, regardless of symptoms, that can tell us about asymptomatic spread. We have a group of long-term care facilities, over 4,000 long-term care facilities, so we can see what's happening in long-term care facilities where they're doing a lot of testing. We have a group from the VA, which is enriched for older people, enriched for minority populations. We have a group in New York that actually matches the immunization records with the hospitalization records with the testing records. So we have a really good line of sight on what is happening across the country, geographically diverse. And what I have challenged our team with, and they have really stood up to the plate, is to say we need to take a snapshot of these and look at the data every 2 weeks, every 4 weeks, to say, how are these cohorts doing? Who's coming into the hospital? Where is vaccine waning? Which demographics is it happening? And we're doing those readouts now pretty much in real time and publishing those data in real time. as we started to do so in early August, we started to see that there was some waning with our vaccine effectiveness, just with regard to infections. People weren't getting that particularly sick yet, but just with regard to infections. And that foreshadowed, we may be seeing this soon with regard to hospitalizations and severe disease. And that's really, and especially since other countries, Israel a little bit ahead of us, was starting to see some of that waning in severe disease. And that's really where we came together and said, as a country, as a government, we are planning for this. We know that this might happen. We're starting to see the data that it might happen, and we are now planning for this. Now, of course, we want to present those data, and the companies have to present those data to the FDA for their regulatory action. And then we at the CDC have an advisory committee on immunization practices, the ACIP, that will make recommendations. But we anticipate that as we start seeing data on waning, especially in those who got vaccinated first, are most vulnerable. And we start seeing the safety of those third doses that we are now collaborating with Israel to get a good line of sight on, that we'll be able to make recommendations about getting boosters.
And will those booster shots begin later this week as planned, or?
So I'm not going to get ahead of the FDA's process, but we are planning, and I'm hopeful for the timeline that's been mapped out.
Okay. You know, you mentioned obviously you're taking care of this country, you know, that's your job, but you also are a global infectious disease expert. And you know that there's been so much pushback from around the world, from the WHO saying this is like giving a life jacket to someone who already has a life jacket, when so many countries barely have any vaccine. Your counterpart in Africa said it's not fair. And you've worked on infectious disease in Africa. I wonder how you respond to that criticism.
I think it's a false narrative to imply they're mutually exclusive. My job as the CDC director is to protect our country. I do that by making sure that the people of this country are safe. And I do that by making sure that the rest of the world is safe, so that people don't bring other things into this country, other variants, other diseases, right? We have already donated 130 million doses of vaccine to 90 countries. And when I think about what the impact of boosters will be here in the United States over the rest of 2021, we anticipate perhaps about 100 million doses of boosters being given in the next 3 months. During that period of time, we will have donated 200 million more doses internationally. So I don't necessarily think it's a fair discussion to say either or. I think we have to do 3 things simultaneously. We have to work to vaccinate the world, and we are doing so. We have to work to boost people here in the United States so we can maintain a good level of protection. And we need to work to vaccinate the people who are not yet vaccinated. And we can't focus on any singular one of those paths. We have to do them all together.
Okay. I know you have a sign that says hard things are hard. And I also know you came into this job really thinking about the way Americans look at the CDC and wanting to restore faith in the CDC. But yet, even in the past week, I know polling isn't everything, but it is one data point. And we saw from the Gallup poll that the CDC's disapproval rating with Americans has gone up again to 41%. I wonder if you can explain the difficulty and how you approach criticism that, you know, guidance keeps changing, whether it was with masks and with booster shots. And I know that you want Americans to be confident in your organization, but how do you respond to criticism that it's still Americans feel they're getting conflicting messages?
Yes, I came into this position in an agency that was being challenged at the time, and in a public health infrastructure that has been, that's had a hard 18 months. My job as the director of this agency is to protect the public health and to make sure that I have a strong 12,000 team to do that on behalf of the public. It has been hard to convey rapidly changing science. I think that you know, people want the answer today, and they want it to stay the answer. And you know, Delta changed things for us in this country, and the science for Delta evolved. And my responsibility was to review the science, review it carefully, update the science to protect the American people. And that's what we did when we put masks back on. And in fact, I will say that we did it in pretty record speed. We did an outbreak investigation with colleagues in Massachusetts that demonstrated that you could transmit if you happen to be a breakthrough infection with vaccine. We corroborated that within a weekend. We published the data within a week, and the guidelines had changed that week. That's hard to, move a train of 300 million people through to convey that science. But that's what we needed to do. And I think people really, certainly the data have corroborated what we did time and time again right now. And so from a public health standpoint, that was the right thing to do. Mm-hmm. So while I do worry and think hard a lot about the confidence and the polling as you're talking about, what I do want to convey is that we are actively following the science, and that science as it evolves is resulting in our evolution of guidance. And that's what I was asked to do as director of this agency.
I want to try and sneak in one last question, if I can, about the public health system overall. Aside from the pandemic, I know you're looking down the road and seeing a public health infrastructure that really is going to need a boost. Can you talk about what state you think our public health system is in and what exactly is needed? And I'm going to make this challenge even harder by saying we have just about a minute left. I'm sorry. Okay. It's such a big question, but it's an important one. I want to make sure and get to it.
Great. So I will just say there are four areas that I think are really key here. One is the workforce. 2 is our laboratory capacity. 3 is our data infrastructure and our data monetization. And 4 is a focus on equity. So those 4 things are top mind. But maybe I'll just focus on one data point with the workforce so that people really understand where we were. Since 2010, we have had the threat of H1N1 influenza. We've had the threat of Zika virus. We've had the threat of Ebola virus. And now we've had COVID-19. Since 2010, the public health workforce has lost 50,000 jobs. Mm-hmm. And just when you sort of understand what has happened in public health during a time where we should have been building that infrastructure, you understand the work that we need to do to get to the place where we can protect public well again.
Dr. Rochelle Walensky, thank you so much for your time and for joining us. And thank you for your work.
Thank you so much for having me.